Atrial fibrillation, a future genetics who want to engage with people and patients so that they can better understand diseases and illnesses that are relevant to them. The information provided here is for educational purposes only. Please always see your doctor for any concerns you may have. My name is Alice and I'm a research scientist. Today I'm going to summarise atrial fibrillation. I'll begin by giving you an overview of the disease and then move on to talk about the symptoms, causes, diagnosis, treatment and complications that are associated with atrial fibrillation. The symptoms. Paroxysmal atrial fibrillation usually stops within 48 hours if left untreated. Persistent atrial fibrillation is atrial fibrillation that lasts longer than 7 days if left untreated. Long-standing persistent atrial fibrillation is where you have had continuous atrial fibrillation for a year or longer, and permanent atrial fibrillation is where atrial fibrillation presents all the time. A normal heart rate should be between 60 and 100 beats per minute when you're resting, and it should be regular. You can measure your heart rate by feeling the pulse in your neck, on your wrist, or by using a blood pressure machine. In atrial fibrillation, the heart rate can be much higher than 100 beats per minute. This causes problems including dizziness, shortness of breath, and tiredness. People with atrial fibrillation often describe noticeable heart palpitations, where your heart feels like it's pounding, fluttering, or beating irregularly, often for a few seconds. It can, however, last as long as a few minutes. Sometimes atrial fibrillation does not cause any symptoms, and a person who has it is completely unaware that their heart rate is irregular. If you notice any change in your heartbeat or your heart rate is consistently outside of the range I stated earlier, then I urge you to go and speak to your GP.